Now, it was a bumper year for test tube babies. In 2006, the number of successful IVF treatments in the UK has topped 10,000 a year for the first time. Newly released figures for 2006 show that 10,242 mums gave birth to test tube babies, a 13% rise on the year before. It's down to more women opting to have IVF and improvements in the science. In vitro fertilization, IVF for short, is when an egg is fertilized by a sperm outside a woman's body. The resulting embryo is then transferred to a mum's uterus with the hope it'll successfully grow into a baby. A media storm was created 30 years ago when the world's first test tube baby was born. Louise Brown has now gone on to become a mother herself. And to date, there have been over 1 million IVF births worldwide. 1 in 7 couples have fertility problems, and IVF has helped many thousands have the baby they've always wanted. But there are moral concerns about the procedure. Half of fertility experts reckon women who are obese or who smoke shouldn't be allowed treatment. Not looking after your body can cause fertility problems, so some doctors think it's fair enough to ask patients to ditch their bad habits first. Funding and multiple births are also issues with IVF. Twins and triplets are common in IVF because several fertilized eggs are implanted at once to increase the chances of a successful treatment. But there are more likely to be problems during pregnancy and a higher chance of premature birth. To try and tackle this, fertility experts are now recommending that more women should have just a single embryo put inside them. But there are concerns that this may reduce the success rate and increase costs.
A single embryo transfer will reduce our chances of having a conception in future, and we will then end up having to pay for even more cycles for the chance to have one healthy baby.